made a choice to visit this webinar today to learn all about oral care, healthy mouth, and healthy body. See, I believe that God has blessed us with a miraculous body and a mouth with teeth and gums and a tongue. And one of our gifts back to God is to make good oral care a top priority. So I'm saying, dear Lord, thank you for inspiring me today to say the right words, to motivate all of the people visiting on this webinar today to start taking better care of their teeth, because the answer is always in preventive health care rather than getting to the point of pain. So thank you, God, for watching over this webinar, guiding everything I say, and amen to that. And now we'll move on to the first slide, and I love this picture of the happy tooth. Today we're going to talk about all things related to the mouth, like your teeth, your gums, your tongue, your smile, bad breath. That's an issue for a lot of people. Oral irrigation, mouthwash and toothpaste, teeth grinding, how and when to brush your teeth, how to keep your mouth healthy and pain-free, even nutritional supplements for oral care, and how periodontal disease can be passed through kissing. Yes, I just said that. And we'll even talk about the 80 million bacteria that are exchanged in just one 10-second French kiss. So buckle your seatbelts for this educational and, I hope, entertaining ride through the ABCs of oral care. And if you've seen any of my webinars in the past, I do it a little differently than most people. I've prepared these slides to show you substantial detail about the subject for which I have great passion, which is oral care. And my goal is to provide you with a resource that you can study in depth in your own time, and it can act as a reference point for you in the future. And shortly after this webinar, you will be sent an email copy of it so you can watch it anytime you want. So in other words, today, with all of these slides and lots of information, I'm going to just highlight and expound on some of the key principles for your immediate learning opportunity. And then you'll have an opportunity to peruse this webinar in your own time, availing you to all the copious detail that I have set out here. So I hope you will revisit often. Now, why am I so passionate about oral care? Just a little backstory here. When I was a teenager, my grandmother Fritzie, who came to America from Denmark, started talking to me about the importance of keeping my teeth healthy and strong. And while most of her friends of her same age were losing their teeth and getting dentures, she kept all of her white teeth throughout her life. She never had a cavity or a filling, and her friends always asked her what she did to keep her mouth, her teeth, her gums in tip-top shape. So Fritzie taught me what to do and also encouraged me to become a dentist, which I almost did. But then at the last moment, I thought I wanted to go into holistic health for the whole body and not just the mouth. But I never lost my passion for oral hygiene and keeping up on all the latest advances. So here's a very brief introduction. Good oral care is directly related to your overall health. When you take really good care of your teeth, then you'll have a bright and healthy future. You'll see how periodontal disease, gum disease, and other oral health issues have been linked to many serious diseases, including heart disease, diabetes, stroke, cancer, Alzheimer's, and more. And if you want to have a bright and healthy future, one of the first places you want to start is your oral care and to adopt a good oral health program now. And you never want to underestimate the importance of brushing your teeth regularly and keeping your gums healthy. Well, of course, we'll talk all about how to do that throughout this webinar, but also it makes you feel better when you know your teeth are looking good and you don't have issues in your mouth. And healthy teeth for most of us means that it boosts your confidence, you have a more polished appearance, and you have overall satisfaction of life. Now, here's another happy tooth. We want all the teeth in our mouth to look happy like this. Now, oral hygiene is also known as oral care. All it is, it's the practice of keeping your mouth clean, free from disease. This is done by brushing your teeth, and then in between your teeth when you floss and use oral irrigation. And it's important that it be carried out every single day. Some people think that they don't have to do it because they'll just go to the dentist twice a year and they'll take care of it. Well, it doesn't work that way. And you want to keep your teeth clean and brushed well and oral irrigated and flossed every day because you want to prevent tooth decay and you want to prevent gum diseases like gingivitis and periodontitis. And here I thought you might want to look at what the inside of your tooth looks like. You can see the enamel and you can see your gum and the dentin and the blood vessels. And, it's divided into a crown, a neck, and a root. I just think it's important to know your body well. You live with this one beautiful, miraculous body for your whole life. And if you know a little bit about how your teeth are designed by God, then maybe you'll take a little bit better care of them. So these are some of the topics we will discuss today. How you need regular dental visits, nutritional supplements, even about animal dental care, cigarettes and vaping I have to talk about because we want to get any of you who do either of those to stop doing it immediately. And I'm gonna spend plenty of time on the mouthwash to talk to you because I know a lot of people use mouthwash. What do you usually use it for? For bad breath. But you can often be doing much more harm than good by using mouthwash. So we will definitely talk about that. Now here are excuses that people have told me for not adopting a good oral hygiene program. Can you identify with any of these? Maybe you say your hands are too big to brush your teeth or floss, or you don't want to floss or brush a lot because it makes your gums bleed. Well, there's answers to all of these. So as you read through these, a lot of people say to me, well, what good does it do? I'm getting older and losing teeth is a part of aging. No, no, no. Your teeth are created to last a lifetime if you take good care of them. My teeth are too tight for floss, so I'm going to be addressing all of these. And let's start right now. If anybody is thinking my hands are too big, there's to floss. You can get these little power floss holders that makes it really easy, and you can still floss every tooth. You can get them at any drugstore. Sometimes your dentist will sell them. They're very inexpensive. If you tell me you don't want to take care of your teeth or floss because it pushes food farther down into the pocket, pay attention here because the floss cleans about 30% of the tooth surfaces, and its primary function is to remove that invisible film of bacteria that is always forming between the teeth, causing the plaque. If you say your gums bleed, they bleed because you're not taking good care of them. Even in the mildest form of periodontal disease, that's called gingivitis, your gums will redden, they'll swell, they'll bleed easily. But keep in mind, because I'm into preventive medicine here, and this can always be reversed with professional treatments and good oral home care. You don't want it to get to the point where it's so far gone that you need major dental work. So other excuses, can you believe this? I have had people say to me, well, I get my teeth cleaned at my dental office twice a year, so I don't need to brush and floss. Well, if you have that attitude, you've got to abandon it right now, because if your plaque isn't removed, it will turn into a hard substance called calculus or tartar in less than 2 days. 2 days. And it's so hard to remove then that it can't be removed so much at home. You have to have a professional cleaning. but daily cleaning of brushing and flossing and oral irrigating will help minimize that calculus formation. Some people say it takes too long. Oh, please. That's a feckless excuse. If you brush and floss every day, it takes a total of about 5 minutes. If you add in oral irrigating, it's about 7 minutes for the whole 24-hour day. Think about it. This is less time than you do with shaving and applying makeup. And if you make your oral care, which I hope you'll be doing by the end of this webinar, a top priority in your mouth, you will say, I can take 5 to 10 minutes to take good care of my teeth and my tongue and my gums so that I never have to have major issues looked after at the dental office. Like I said a moment ago, a lot of people think that losing teeth is part of aging. That's definitely not true. More and more people are living longer lives and keeping their natural teeth longer, but only by brushing and the flossing. And you want to make sure you're using the right equipment, that you brush properly. We'll address this more later. You don't want to have bent or frayed bristles on your toothbrushes. You want to brush your teeth at a 45-degree angle, not back and forth and not hard, but with gentle circular motions. And if you say your teeth are too tight to floss, there are special kinds of floss that you can use. For my friends that ask me about this, I say that there's a polymer floss that's approved by the ADA, and it gets into your teeth more easily and doesn't break off. So other excuses could be when flossing back and forth, it's just hard to get the floss down and in. And the floss, you can revisit this slide and you can learn more about it later, but you make a little C shape around your tooth, and you repeat this process in every tooth, and you go back and forth gently, and you move it up, and it's simple to do, and you've just got to get in the habit of flossing. I had someone once tell me that it gets in the way of intimacy with my partner. I'd rather kiss than floss. Well, quite honestly, I wouldn't want to kiss anyone that doesn't have good oral hygiene, and you'll see more a little bit later about why I'm saying this. The periodontics is that branch of dentistry that's concerned with all the structures surrounding and supporting the teeth. And did you know, I bet you didn't, that periodontal disease can pass through saliva? I'm going to say that again. Periodontal disease can pass through saliva. This means that common contact of saliva from kissing your loved one may put your loved one at an increased risk of contacting periodontal disease. So is this really what you want to pick up from another person? I don't think so. And is this what you want to pass along to another person? And I love these diagrams because a picture speaks 1,000 words. You can see what the healthy mouth and gums looks like there, the tooth, where the gums are pink and they're not inflamed. And then you look at the gingivitis. You've got the inflammation of the gums, and it gets swollen. That's when a little bit of the pain starts. And then you get to periodontitis. Itis means inflammation of the gum here. You can see the pockets are beginning to form, much more swollen, much more pain, and then you have advanced periodontitis. That's not what you want. And again, the whole goal of this webinar is to teach you to take such good care of your teeth that you won't need to deal with any of these issues. Please visit your dentist at least every 6 months. I'll tell you throughout the slides what I do too. I go 3 times a year, not because I have any dental issues. I have none, but I want to keep it that way. And I know that there are things that they can catch and find out and just do the extra special cleaning. And it's like a booster shot to me. Every time I go to the dentist and they've done the special polishing and cleaning, it motivates me to take better care of my teeth. And the dentist always has these professional tools that can get into areas that might be a little bit more difficult to you, for you to get to. And I always say what is that saying, that an ounce of prevention is worth a pound of cure? I think that's what it is. But you want to do your daily oral hygiene proper program to help you so you don't have to go to the dentist with painful issues. And, of course, this goes without saying. You want to set a good example for your children. It's important for all of you parents to let your children see you brushing your teeth. And when you take them to a dentist, pick a dentist that has a friendly and a positive attitude that will make the child want to go. And I always say, well, what I always do is I go to my dentist and hygienist with a list of questions so I can learn more each time I go. Oral care is not just about how the teeth appear, and it's not just about having a beautiful smile, but it's what's happening on the inside. So listen, your dentist is smart, and if you don't like your dentist, pick another one. At the end of these slides, I'm going to show you a dentist I go to in Southern California, here in Santa Monica. But usually your dentist has very sage advice about how you can do a better job. Whenever I go see my hygienist, I always say, tell me what areas of my mouth I need to work a little bit more on, so next time you won't say to me, we've got a little issue in the very back of your lower teeth or behind your front teeth. Those are two areas where I have to work a little bit more. When to call your dentist. You know, I've had people say to me, Susan, I don't want to call the dentist because I'm afraid of what I'm going to find out, and then it's going to cost a lot of money, and and then it hurts, and I don't want to have expensive dental work done. But when you ignore those initial signs of dental problems, you risk causing further harm to your oral health. And the best time, well, besides going at least twice a year, if you have any serious and obvious signs of problems, maybe you've got bleeding gums or swollen gums, or you just touch your toothbrush to your gum and you feel a pain, anything like that, you want to go right to the dental office and see what it is. But when you take these small steps now, I promise you, it will save you a lot of time and money in the future. And like I keep saying, the cost of regular cleanings every 6 months is far less than the price of those big fixes that will need to be done should teeth and gums become neglected. And if the cost is a issue for you, check into getting dental insurance. You know, I've had that for years and years. And it's worked because it gives me free cleanings and free x-rays, and I haven't had any big dental problems. I'm knocking on wood. But just recently, my dentist in Santa Monica has a concierge program. And so I paid a certain amount, and I get 3 cleanings and x-rays. By the way, because I keep my teeth really, really clean and no problems, I don't even get x-rays. I don't think they always push x-rays on you with every visit, and unless you have dental issues, I don't think it's a good idea to get x-rays every issue. But again, I'm not a dentist, and you can check that out with your dentist. But I've got a good plan with my dentist. See if your dentist offers a good plan like that. So we don't have time to go through all of these teeth jokes, but I'll read one to you because you can revisit this and read all of these. Your teeth are like the stars, he said, as he pressed her hand, so white. He spoke the truth, for like the stars, her teeth came out at night. So I like that. And if you've seen any of my past webinars, I like to bring in some positive thoughts and affirmations and some jokes. So here's, I don't know exactly what they were referring to in Genesis 49:12, but I think we all would like to have straight and white teeth. It's interesting how teeth whitening has become so popular in America, and it's catching on, I'm glad to say, in the UK, Canada, and Australia. Although, on a personal note here of observing people, and I work with lots of celebrities on TV and movies, I think some people get their teeth way too white, and it looks really artificial. If you look at this before and after picture right here, that after picture looks lovely, and the woman up above looks lovely, but sometimes people get their teeth so white that it almost looks like they're going to glow in the dark. And when you have attractive, healthy-looking teeth, I think for most people that represents a higher level of success and prosperity. Sometimes when I go to the movies, I'm probably surprised I'm going to be saying this to you, but you know how big the movie screen is. And then you look at some of the actors and actresses' teeth, and especially the bottom, and you see that, well, it looks like they straighten the top, but the bottom teeth are all crooked. And I always wonder why they let that happen, because it's so easy to simply whiten your teeth. Here in Brentwood, Santa Monica, where I live, they have, every few blocks, besides a juice place, they have organic whitening shops where you can go in. And I've got different natural ways you can whiten your teeth I'll talk about later. But it is so easy to whiten and straighten your teeth. And even people now in their 40s, 50s, 60s, and 70s, I know a neighbor who lives not far away, up the block. She's in her 80s, and she's wearing those Invisalign braces to straighten her teeth, because she thought in her life she wants to have straight teeth. So you might want to look into that. It's not too expensive. You can get these invisible braces, and it might make you feel a little bit better about your smile, and you'll smile more, because that's what we all want. Here are some more little sayings you can read when you visit back here. Peace begins with a smile. Mother Teresa said that. I love that. And so you can check these when you come back and visit, and we'll move along. What are some reasons to straighten your teeth? Appearance. When you have really crooked teeth and yellowed, broken down teeth, it does affect your self-esteem. Similarly, if you have an overbite or an underbite, it's going to affect how you smile. Crowded teeth, crooked teeth, and they all can lead to swollen, red, bleeding gums, because it's difficult to brush and floss around the teeth. Straight teeth are healthier teeth. Studies have shown that straight teeth get fewer cavities. They're less likely to have problems with discoloration, uneven wear, and fractures. Straight teeth and healthy gums means you can chew anything you want. And who doesn't want to bite into a beautiful big red apple or a carrot or almonds and not have to worry about teeth issues? Your teeth are also less likely to be sensitive to heat and cold, and you lower your risk of painful and expensive dental problems when your teeth are straight. Here's some more reasons to my vote for straight teeth. Listen, we live in a society where appearance does matter, and studies have proven over and over again the advantages of having an attractive appearance and smile as it relates to opportunities. They've shown that people with straight, white teeth make more money than people with crooked, yellowing teeth. And like it or not, your smile is a reflection of you. Now, this might fascinate you. Maybe you already know about this. But when you get your teeth straightened, it's going to help you live longer. And there are studies that prove that people who floss daily, not monthly or a couple times a year at the dental office, but daily, will live an extra 7 years longer. And flossing can be fun when you have room for it, but not so fun when your teeth are crooked and crowded. And there was a study done, as you can see here, in 2009 that showed that people with gum disease are 24 to 35% more likely to suffer coronary artery disease. So, if you have straight teeth, they're easier to clean, and therefore you're less likely to have gum disease and heart disease too. A few more reasons. Some people have teeth that protrude like buck teeth, and especially if you're into physical activity and sports-related injury or who knows, schoolyard brawls or, even a car accident. When you have protruding teeth, you can damage them more easily. So if that's a problem for you and you have a big overbite or underbite, by getting your teeth straightened and your protruding teeth put back inside your mouth, you'll have a better chance of keeping them free from injury. So you can always talk to a dentist and a orthodontist about that. Now, this is a huge topic. I'm going to say right off the bat that if you smoke or if you do vaping, you got to do whatever you can to stop it immediately. The tobacco found in cigarettes, as we know, has been proven to be among the most damaging things you can introduce into the mouth and into the body. When you smoke, it causes permanent discoloration of your teeth, as you see in the lower photo. It wears away the enamel. It permanently changes a person's breath. Have you ever been around, if you don't smoke, a person who smokes and you're up close with that person, you just don't even want to breathe in his exhale. It leads to multiple oral-related cancers. It also leads to throat, lung, tongue, and other cancers. And listen, you can't turn on the TV at night now, almost any night on the news, and not get another story about this vaping and e-cigarettes and hearing how someone just died. Weeks and weeks ago, it was just one or two people. Now we're getting into hundreds of people, or they have a lung transplant, or they're hospitalized for respiratory issues. And they say that we got to stop flavoring these cigarettes, but no, you've got to stop vaping totally. They call it juuling or vaping. If your children do it, if you do it, you must find a way to stop. And I always say that nothing is impossible with God. God is with you. And your dentist can help you with that. There are groups that can help you with this. It's an addiction. But the most important connection you have is with God, to ask God every day to help you to give up your smoking and vaping if you do that. And also, I want to be really clear, because I know kids in their 20s and 30s and teenagers that say, "Oh, but it tastes so good, and even if it hurts me now, science will come up with a remedy for it when I'm older if I come down with a disease." So I want to be perfectly clear. Vaping and smoking poisons the brain and the body. It causes respiratory illnesses, pneumonia, death, cancers. If you are addicted to smoking and vaping, you must find a way to stop immediately, because your life may depend on it. Now, here's a topic. Who else would talk to you about it but Susan here, yours truly? Do you bite your nails? I see a lot of kids biting their nails, and I see adults sometimes when they're nervous biting their nails. It can cause serious damage, not only to your hands and how the appearance of your hands and how they look, but also to your teeth. Our teeth were not designed by God to withstand constant nail biting, and I'm a stickler on keeping hands clean and our environments clean, and most individuals have no idea how much bacteria they are introducing into their mouths when they bite their nails. Your hands are dirty, let's face it. You're touching things all the time. And remember that your children will imitate what you do. They always do. So you need to be a shining example for sound and sturdy oral care and vitality. So how about ice chewing? I know when I was a kid, I used to love to chew ice. By some miracle, it didn't damage my teeth, thank you, God. But it's one of the most damaging things you can do for your teeth. That's chewing ice. And although many people don't realize this, that it's doing such damage, the effects of chewing ice can cause major problems in your mouth, because it causes the surface of the teeth to crack and break. It wears down the enamel. It makes the teeth more susceptible to further damage, like cavities, because it breaks your teeth, and then the bacteria and acid and sugars go inside the breaks and cracks. And it's similar with eating ice cream. Did you know that ice cream can ruin fillings inside your mouth because the coldness of the ice cream causes the filling to expand, and that shortens the lifespan of the tooth and the filling and increases sensitivity. And if you also chew ice, it can damage the gums, crack the teeth, as I said, cause headaches, cause a soreness in your jaw, and also brain freezes. I think we've all experienced that. And by the way, chewing ice can be a sign of other health problems like anemia. So if you're addicted to chewing ice, and some people are, I would check with your doctor to see if you need some professional help and if you have anemia. All right, here we have some more funnies. Let's see. I like this one, the Rodney Dangerfield. I told my dentist my teeth are going yellow. He told me to wear a brown tie. That's great. So when you revisit this webinar, come back and visit these jokes. And I love that little cat on the computer smiling. And we'll talk about dental care for cats and dogs in a moment. So listen, we're going to go through some of these right here, but I'm not going to go through all the slides in detail because I know you'll be revisiting and we don't have 4 hours to do this. But to motivate you to make your oral care a top priority, here's some reasons below, and we'll just quickly go to the next slide. We're going to talk about dental care. So listen, plaque is really interesting because you can prevent it from building up on your teeth. I love that it's not, listen, it will happen on your teeth. You will get plaque, but you can brush it away. Plaque is that sticky substance that develops on the surface of the teeth. And so just to make this as simple as possible, I wrote this here. It's a combination of bacteria, proteins, and minerals that are in our saliva. So we take in food, we chew it. A lot of digestion is done in your mouth. And then the minerals fixate on the tooth surface above the gum line as well as below the gum line, providing bacteria with a place to adhere. And then the bacteria are these living organisms in your mouth, and they eat and digest just as we do. And it's the toxins within the waste of the bacteria that can present problems. And now, and don't be nervous about this. You know, that bacteria has a common place within us, in the body and within the mouth. But it's when we don't keep our mouth clean and give it a clean environment, we don't have good oral care, that we begin to have problems. Periodontal disease starts under the gums, and it's often you can't see it. And it's a result of neglecting these toxins from not brushing and flossing and oral irrigating on a daily basis. And you hear these words, periodontal. That's the first stage. The first stage is called periodontal disease, referred to as gingivitis. And gingivitis, and this is really important to hear this, it's most common among people in America and worldwide, but it's the most overlooked. And the gums become inflamed, and then they start to bleed. But note that right here at this point, if you have gums that feel or look inflamed and maybe start to bleed a little bit, maybe you see when you rinse your mouth out with water, spit into the sink, you see a little pinkness, and very important, and you need to do a better job to circumvent any future or further problems. A little bit more about plaque. See, oral care is amazing, and how you take care of your mouth affects your entire body. And here's a way to understand this. Most people, most of you, are familiar with instructions that are given to heart patients when they experience chest pains. What is it? They're given a nitroglycerin tablet. So where does the doctor instruct the patient to put the tablet? That's right under the tongue, and it's because there's a series of blood vessels under the tongue that allow this medication to enter the bloodstream more rapidly, thereby affording the patient the relief he or she seeks. And the main functions of the bloodstream are to rid the body of toxins and to transport oxygen and nutrients to heal and energize the body. But if the toxic buildup is greater than its riddance, these toxins can find their way to our vital organs. And this is the basic link between periodontal disease and how it affects our overall health. You'll see a little slide about that in a moment. How do we prevent gum disease? Look at the picture on the left. That's a beautiful pink gum, healthy gums. And then you see how the periodontal disease begins. Your gums get inflamed. You've got plaque and calculus. You see that on the tooth. You have the pocket deepening. You know how they check the pockets? The number, you get a number when you go to the dentist. You see it can get inflamed. And gum disease is basically a swelling or soreness of the gums, that soft tissue around your teeth. And as mentioned, it's caused by a bacteria in plaque, a sticky, colorless film that forms on your teeth. And in a little bit, I'm going to talk about how oral irrigation really helps with that. So these toxins can lead to inflammation. This is an initial stage, the gingivitis. And remember, it is reversible. So once you see any of this happening, it knows you're not doing the best job up until now on taking care of your teeth, and you can do a much better job. The signs of gum disease are not easy to see, and they can be painless. But the earlier the gum disease is caught, the easier it is to treat. One simple way is when you're rinsing your mouth out with water. Do you see any blood making the water pink when you spit it back into the sink? Do you touch any areas of your gum and maybe it feels a little sore, because it should not feel that way? Here's a good picture. See the tooth? And you see you've got inflammation in the gums on each side of the tooth. The pockets are deepening, and then the blood vessels carry these toxins out through your vessels into your heart and into your brain. That's why a healthy body starts with a healthy mouth. Here's some pictures to motivate you. Maybe your children or little ones, toddlers, will love to look at these pictures. I always think it's good to look at the inside of your teeth, since it's hard for you to do that. Protecting your heart. Now, I've already said that plaque buildup will result in harmful bacteria that enters into the bloodstream that affects your heart's ability to pump efficiently. And inflammation of the gums, they do say it has a connection with clots forming throughout a person's body. So listen, if this doesn't inspire and motivate you to take better care of your teeth and your mouth, I don't know what would. And keep in mind that the same life choices that lead to good gum disease are the same ones that lead to gum disease are the same ones that lead to heart problems. We want to avoid all those high sugary foods and drinks and junk food, anything made with white sugar and white flour and preservatives and additives, and especially the sugar, and opt for whole foods. I love this picture. It's so beautiful, the vibrant foods that God has created for us to eat. And then you want to keep up with regular brushing and of course, the exercise, the sleep, keeping stress levels down. And I want to say something about the Barley Max. I've taken Barley Max by Hallelujah Diet for years and years, and I would never be without it. I have to say it's my number one most favorite supplement. I usually take the Barley Max just by the spoonful and let it kind of melt and dissolve in my mouth, and then you definitely want to brush your teeth after that. But I love the original and the mint and the berry, and I usually have Barley Max in the morning and my Advanced Superfood by Hallelujah Diet in the late afternoon, like that little kick of energy and nutrients going in my body. And if I'm under a lot of extra stress, I'll do Barley Max twice a day, but I would never be without it. I take it everywhere with me when I travel. It's always with me, and it's my number one favorite nutritious, raw, life-giving, nutrient teeming supplement that I think everyone should take every day, children and adults. So smile every day. I say this a few times during the webinar. Teeth are always in style. Smiles are contagious, so go forth and contaminate as many people as you can. Diabetes. If you're diabetic or pre-diabetic, do you know that you often have more dental problems than people who are not? Gum disease leads to countless issues within the entire body and affects the ability to control insulin levels, which will trigger diabetes naturally. Another reason to be preventive in your oral care program, take good care of your teeth. And if you have been diagnosed with diabetes, you're going to take extra better care of your teeth. It's very important. Oh, let me go back. How do you like these bellies? This is we want the belly on the left rather than the one on the right. And I like that juice up above there and the vegetables because I'm totally into juicing every day. I'm a vegan. My grandmother, when I was a teenager, taught me the importance of eating a plant-based diet, and I've pretty much been a vegan ever since, and which is why I'm as healthy as I am, among other things. So an abscess, if you've ever had an abscess, I haven't, but I know many people who have. And keep in mind that your mouth is prone to buildup of so many things, too much acid and sugar and bacteria and toxins, and then your gums get inflamed. And this picture shows you how your gums can be inflamed and toxins go down and it gets red and swollen, and you might have open sores and a foul breath. These are all some of the signs that go along with an abscess in your tooth. They're very painful, and you never want to ignore a tooth abscess because that can lead to eventual removal of a tooth or a root canal. And listen, everybody, you want to save your teeth. If at all possible, you don't want to lose your teeth. And if you take good care of your teeth, you won't be losing them. So I bet many people might not know this, that obviously if you're pregnant, it impacts your whole body. But many people don't realize that you want to keep your teeth extra clean and your oral hygiene program better than ever if you're carrying a fetus inside of you, if you're pregnant, because here's why. There have been many links between gum disease and miscarriages as well as premature births. So remember that bacteria I talked about a moment ago builds up in the mouth, and then it can quickly spread throughout your body, but it won't do that if you have a good daily oral care program. So you want to keep up with that, especially when you're trying to grow another God-given life. And make sure, especially when you're pregnant, to stay up on your checkups with the doctor, to do your brushing at least twice a day, your flossing, your oral irrigating, and they're all safe to do when you're pregnant. Now, I'm just trying to go to the next slide here. Here we go. I love this idea. Now, this is what I do in my life. I work on keeping my weight down. Sometimes it's a little bit harder. During the holidays, it might be a little bit harder. Maybe when you eat a little differently. But brushing your teeth, I think, well, for me it does, it triggers the mentality that it's time to stop eating for the day. So if you get into the habit of brushing your teeth after that last meal at night, then eating again would mean you have to brush your teeth again, and for me, also oral irrigate. And keep in mind, Ben Franklin once said that whatever you do for 21 days will make or break a habit. And behavioral scientists have said if you do something for 21 days in a row, like brushing your teeth and flossing and oral irrigating, or you keep something out for 21 days, like eating any sugar, after 21 days you will have accepted a new habit, or you'll no longer crave what you gave up. So I say make an agreement for 21 days so that your brain and body can accept a new habit. Make an agreement to brush your teeth and maybe floss and oral irrigate after your last meal. So once you've established that routine, then all of a sudden at night, if a cookie craving kicks in and you've already brushed your teeth and done the oral irrigator, you might not want to go get that cookie. And besides, foods taste a little different after you've brushed your teeth, right? So this will help you not to have those cravings at night, or if you have them, you won't give in to them. And it will help you keep your weight in check. Chew and speak properly. See, if you let the decay in your mouth go on too long and you get infections, then sometimes the infections can affect your lips and your jaw and your tongue and causing problems with speech. So it's important that you keep a good, healthy mouth. You want to be able to chew properly, because we all love to chew and eat great meals, especially plant-based meals. It makes it more enjoyable, and you don't want it to be difficult when you're eating. I know many people that have ignored their oral hygiene, and they're even in the 40s and 50s and 60s. And now all they can do in terms of eating is pureeing most of the food, or eating foods with softer textures. And you just don't want that. You want to be able to eat all the foods you'd like. So I'm going to just take a drink of water. Hold on. Okay, here we go. Bad breath. So we've all experienced it. Maybe most of us have had someone tell us, ooh, maybe you should chew on a mint or something. But here's what I want you to know about this, and it's called halitosis. When bacteria build up, they're accompanied by a lot of nasty things going on in the mouth. First of all, you get that funny smell. And think about it this way. When you keep foods out in your kitchen counter without storing them properly, it quickly starts to go bad, and it smells, right? You can smell it. Even sometimes you open your refrigerator and you have that funny smell because foods have gone bad there. Well, the same thing applies to the food when it gets stuck on your teeth. And if it sits there long enough, it produces a very nasty odor, making it uncomfortable for other people that are close to you. But if you maintain your regular checkups at the doctor, and you floss and you brush and you oral irrigate, it will work wonders in preventing bad breath from occurring. We also know that there are certain foods that cause odor, like garlic and raw onions. And remember that a few extra sprigs of parsley and some natural mouthwash might help there. I also know that the barley max, especially the original, is wonderful if you've just had garlic, and then put a spoonful of the barley max in your mouth and then rinse your mouth out so nothing looks green, and that will help with the bad breath. So, and then listen, this goes without saying, if you have abscesses and missing teeth and plaque buildup and discolored and crooked teeth, it's going to affect your confidence. When the body is not functioning as efficiently as possible, it often affects your mood and your comfort levels. So there's so many reasons to keep your mouth in top-notch condition, as healthy as possible. Here's some more sayings that you can enjoy when you revisit. But I like this last one. And next time you go see your dental hygienist to get your teeth clean, give him or her this note. Thank you for being my teeth cleaning, floss threading, pocket probing, root planing, enamel sealing, perio preventing, biofilm removing, oral cancer checking and prevention specializing dental hygienist. I guarantee you, I did that once, and my hygienist in Santa Monica, I've never seen her smile so big, and I had to read it in front of me so I could see the smile. It was beautiful. So you can check on these later when you revisit. So your teeth should last a lifetime. I know when someone smiles at you or you smile in the mirror, you see just basically your teeth, maybe a little bit of gum. You see your lips. But your teeth make it possible for you to chew your food. And your teeth are held into place by your gums. This is why we don't want to have, one of the many reasons we don't want to have any trouble with the gums. The function of the gums is to protect your teeth. And your teeth, yes, they were designed to last a lifetime. It's gum disease, also known as periodontal disease, that would cause you to lose your teeth. I'd love you to memorize all this, learn all this, so when you go see your hygienist and dentist next, you can talk about all of this, and they'll say, what have you been doing to learn all of this? Now, you'll have time to visit all of this, but a lot of people say, well, how does a cavity start? Don't you love these teeth that are fretting over the one that has a cavity? Tooth decay is the lay term for dental caries. And bacteria metabolize and convert the sugars from your diet, so we want to keep those sugars down, into acids and damage the tooth structure, resulting in cavities. And if you don't attend to the cavity right away, then it can get bigger and bigger and go deeper into the teeth, and more bacteria are formed, and then it can travel into those microscopic pits and fissures and contact areas between the teeth where the toothbrush can't reach really well, and then the enamel breaks down, and then you have lots and lots of problems. So you want to get a cavity paid attention to immediately so it doesn't balloon out into something a lot bigger. And I'll say with fillings, too, I encourage you, talk to your dentist about this, of course, to get rid of any mercury amalgams and replace them with non-metallic options. I think that's really important in the mouth. And then again, here are the stages of the dental caries. You can see it starts right on the top of the tooth, the cap of the tooth, and then it goes down deeper, and then it goes a little bit deeper, and if you don't attend to it, it can turn into serious periodontitis and an abscess. But again, I keep repeating this, don't I? But I think it's worth repeating. If you take good care of your teeth every day, you'll never have to deal with this. So let me go up to the arrow. Crowns, I'll let you take time to read this, but a crown is that fixed prosthetic device that can improve the appearance and reinforce the structure of your tooth. I had to get a crown once when I was out to eat with friends, and I had a salad, and there were olives in the salad. They were supposed to be pitted olives. They said they were pitted, and I bit down really hard, and I cracked my tooth, and I didn't want to lose my tooth. The option was pull the tooth out and get an implant, but my dentist said, in Santa Monica, said, I think we can do a crown. Let's do a good crown, and it will completely cover that tooth. We'll keep the tooth strong. We'll prevent you from losing a tooth, and you won't suffer any tooth decay with a crack in the tooth. So that's what I did. There are other reasons to get crowns. You definitely want to talk to your dentist about if you're a candidate for a crown. And people lose their teeth. Remember, my grandmother didn't lose any of her teeth. But when you lose teeth, and especially several in a row, I've got a very dear friend who lives in England, and for years they didn't have the dentistry, the quality of dentistry that we have in America. And any time he had any little pain in his tooth, you know what his dentist did there in England? He pulled his teeth. So he has several missing teeth. And what I've taught him is that your teeth chewing food helps keep the bone in your jaw strong. But when your teeth bite down on just gum and missing teeth, you lose a lot of the bone in the jaw. It's like if you don't use it, you lose it, like with muscle. So there are different things you can do if you have missing teeth. You can have an implant. But these are all things that, because I'm not a dentist, you can talk to your dentist about. And there are different kinds of implants you can get. You can even get, some people will opt to, like, instead of having a root canal, they'll opt to have a tooth pulled and then use a bridge or a non-metallic implant. But I encourage you to talk to your dentist about this, about implants. But there are many benefits of having dental implants. All right, do you have any cats or dogs? There are 3 slides that tell you how to take care of the teeth of your cats or dogs. We don't have time to go through them in detail, but I give you step by step of what to do. But as an overview, you do need to take care of the teeth of your cats and dogs and kittens and puppies. And if you start out early brushing the teeth of your animals, they will get used to it, like with children. One study found that 3 out of 4 pets over the age of 3 already have dental disease. But one rule of thumb is never use your own toothpaste to brush your dog's or cat's teeth, because the ingredients in human toothpaste can make your pet very sick. My veterinarian here in L.A., he sells toothbrushes for pets. They're usually smaller, softer, more flexible, and they even have lessons to teach you how to brush the teeth of your animals. And as we go along here, you can read all this when you revisit, but it's important at least once a year, bring your animals in and let them get their teeth cleaned. As I say at the very bottom here, watch out for signs. Make sure your pet receives professional dental cleaning at least once a year. And protect your teeth. If you play sports where you could be hit by an arm or football or something else, it's good to have a mouth guard that you put on your teeth to help you. Dentists can make them for you, but you can even find readily available ones in many of the stores. So keep that in mind if you're very actively and you play a lot of sports. Grinding your teeth. A lot of people grind their teeth at night. You might not know it if you sleep alone, but if you sleep with someone else, they might tell you that you grind your teeth. This often happens when you're under a lot of stress and anxiety, or maybe you have improper bite alignment. And it's important if you grind your teeth to get a night guard from your dentist. I have to say I have one, because when I'm under extra stress, I'll wear it at night on my lower teeth. And sometimes when I have to drive for an hour or 2 or more in horrific traffic here in L.A., and I get a little stressed out, I like that my night guard is in my mouth. But what you might not know is that the jaw exerts 3 to 10 times more force when you're grinding, like grinding your teeth at night, than when chewing and breaking down the food. And that happens because part of the force is absorbed by the food that you're chewing, and that creates a buffer and a lessening amount of the force on the teeth. But when you grind in the absence of food, the teeth are required to take the entire force of the jaw. And this what will happen is it will contribute to your enamel and your teeth breaking down and making your teeth more susceptible to damage. So, and your dentist can tell you if you're grinding your teeth. Stains on your teeth, I'll let you go through all this, but if you have tooth decay and your teeth, if you have a lot of plaque and calculus, you'll get stains on your teeth. If you have a tartar buildup, you will get more stains. The sugars stick to your teeth and causes the bacteria to grow, and if left too long, it can create a sticky yellowish substance called plaque. So you want to brush every day. If you have celiac disease, you're more prone to having discolored teeth. You want to take better care of your teeth. If you eat foods like coffee and tea and wine and even our wonderful blueberries, that can cause a staining of your teeth. I drink tea every day. There's a tea I've been drinking for about 20 years. You can get it at Hallelujah Diet. It's called Longevity Tea by Dragon Herbs. And I drink 2 or 3, sometimes 4 cups of that a day. And But I always make sure that after I drink tea, because of the dark colors in the teas that can cause staining, I maybe brush my teeth if I'm able, or rinse my mouth out with water. I've already said that tobacco products stain your teeth, whether it's just cigarettes or vaping. And as we get older, our teeth get more yellow. It's just a natural thing, but there are many things you can do to keep your teeth keep your teeth whiter. We've already covered this a little bit, but you want to avoid sugary foods. Do you know that Americans consume about 152 pounds of sugar a year? Now, I don't consume any sugar, and I know many of you watching and listening don't consume any sugar either. That means people consume more than 152 pounds a year. And a can of Coca-Cola has 10 teaspoons of sugar. And the sugary foods not only cause cavities and gum disease, but they lead to obesity, diabetes, inflammation, and cancer. And it's sad to report that even thousands of children as young as 3 years of age are hospitalized in order to have multiple teeth extracts because of the effects of sugar. You never want to put your baby to bed with a sugary drink in their mouth. So that's a whole other webinar on another topic. So you want to stay away from sugar. The acid produced in your mouth then from the sugary foods breaks down the structure of your teeth and destroys your tooth enamel, your dentin, which always results in tooth decay. But if you brush every day, and ideally, if you can brush after every meal, that's great. But at the very least, brush in the morning and in the night, and rinse your mouth out with water many times throughout the day. Here are some foods that are great for your teeth for these reasons. Apples, celery, water, kiwi, onions, okay. Even though they give you a breath, you'll have more quality alone time. But they help remove bacteria from your mouth when eaten raw. Parsley, by the way, is really good for your mouth. Pears, flax seeds, chia seeds. And these are only a few of the many Hallelujah diet supplements I take. As mentioned, I'm never without my Barley Max. My B Flax D has good amount of vitamin D in it for your teeth because your teeth are bones. The professional strength DHA is great. Oral Health Probiotics, I would not be without that because that will help your breath. The Oral Health Probiotic you want to take every single day. I'll tell you in just a moment or two a little bit more about that. The curcumin extra strength helps with inflammation, and the sun is a good source. We know this of vitamin D. The sun helps to regulate calcium and phosphorus. And remember, our teeth are bones, so we want to get enough vitamin D in our body. If you live in areas of the world where you don't get enough vitamin D, and check your blood in your next blood profile, check the level of your vitamin D, because if it's too low, you definitely want to take more. But if you don't get enough vitamin D, and then if you don't absorb the calcium then efficiently, that can result in periodontal disease. So I really encourage you to get some of the B Flax D powder because it's got a high amount, natural source of vitamin D. And tongue cleaning, I bet many of you might not know this, the tongue has the heaviest bacterial amount of any part of your mouth, and it also leads to really bad breath. So you want to help yourself avoid that bad breath by cleaning your tongue. And here's a little plastic cleaner that guy's using. By the way, that's a healthy pink tongue. Or I don't know if it's a man or a woman, but I think it might be a woman. That's a healthy tongue. But half of the bacteria in your mouth lives on your tongue. And this forms a film over your tongue and contributes to a variety of health problems. Your tongue should be the color of that person in the photo. And you just use a scraper. I have this one, and I also have a stainless steel one that I think I like even better than my plastic one. And when you scrape the tongue, and sometimes you have to get used to it because if you go too far back, you can get that gag reflex. But, you'll get used to it. But you want to break up the tissue on the tongue, which helps to avoid that hairy tongue. The tongue has lots of little bumps and crevices that harbor bacteria, and you'll be shocked at the stuff you scrape off of your tongue. And if you want to really have a clean, fresh breath, and you want to get rid of all the unwanted bacteria that contribute to tooth decay, and you want to have a prettier smile, you got to do some tongue cleaning. Brushing your teeth, remember, at least twice a day, but ideally after every meal. I have a manual brush. I use it in the morning after every meal. I have a portable one that I carry with me, and every night I love my electric Philips Sonic toothbrush. There are many on the market. They say I don't have anything to do with the company, but every time I brush my teeth at night, it feels like I've just gotten a professional cleaning at the dentist's office. So you want to make sure you brush the proper way. I talk about it here. And you want to brush for 2 minutes. That's because we have 4 sections of the mouth. They require approximately 30 seconds of efficient brushing, not back and forth, but little circles. And when I brush in the bathroom, when I brush my teeth, I do squats or lunges at the same time. Maybe that's more info than you needed, but that's what I do. Now look at that funny toothbrush at the top with the frayed bristles. You never want your brush to look like that. You want it to look like the one on the left. You have to replace your toothbrush every 3 months. So we're going to go just a little bit over the allotted time so I can get most of this in. Your old toothbrushes lose their ability to get into those hard-to-reach locations. And what I do every week is I put my toothbrush in a little cup of water with a few drops of hygiene peroxide, and I rinse it out. You should replace it every 3 months. I replace mine every 1 month. I just do that. And also, and Dr. Oz has talked about this, make sure you put the toilet seat down in the bathroom. If you have your brushes in a glass like shown in this photo and you flush the toilet with the lid up, do you know that residue, the toxic residue from your toilet can go 10 to 20 feet sprayed out in the bathroom? Even if you wash dirty hands by your toothbrushes, keep them clean and covered. That's so important. Toothpaste, be aware of what you're using for toothpaste. Most people use toothpaste, and it can cause a lot of problems in your mouth if it's made with a lot of additives and preservatives, and a lot of toothpaste have sugar. So look for more natural ones. You'll see examples here. I like ones that have baking soda in it, and I also use toothpaste that has baking soda in it. So I'm going to let you read this on your own, part 1 and 2, but I'm going to talk to you about mouthwash because it's so important, because I think most of you probably use a mouthwash. And why do you use it? It's usually for bad breath, right? And according to the Oral Human Microbiome Database, say that 3 times, there are over 1,200 species of bacteria residing in the average human mouth. In your mouth right now, probably over 12,000 species of bacteria. Some are permanent residents, some are transient. And since the mouth is open to the outside environment, which is for me quite a bit because I talk a lot, a lot of bacteria can get in your mouth. There are a lot of influences on the composition of the microbiome, and mouth microbiomes change throughout life. For example, twins start with almost identical oral microbiomes, and as they get older, their oral microbiomes diverge. But listen to this. Kissing results in an exchange of bacteria. Over 80 million bacteria are exchanged in just one 10-second French kiss. So there are good reasons. Now it's going to make you think twice about who you're kissing, right? There are good reasons to protect your mouth microbiomes and microbes. The bacteria in your mouth can not only help protect your teeth and gums from cavities and gum disease, but they also affect the rest of your body. For example, some oral microbes assist in the production of nitric oxide, which keeps the arteries open and facilitates blood flow. But the problem is that with most people, they don't protect the bacteria in your mouth, and they don't realize that commonly used oral care products like mouthwash can damage the mouth's microbiome and also affect the health throughout the body. Antibacterial mouthwash kills pathogenic bacteria in the mouth that can contribute to bad breath and cavities, yes, but it also kills beneficial bacteria too. And the negative effect is immediate. Let me give you a quick study. There was a group of healthy subjects, and they had their blood pressure measured in a clinic and at homes, and then had their oral nitrate measured before and after using mouthwash for 7 days. And the oral nitrate was reduced by 90%, and plasma nitrate was reduced by 25%. But most importantly, as a result of the oral nitrate reduction, both systolic and diastolic blood pressure increased within the first 24 hours of mouthwash use and continued to remain higher for the entire 7 days. So again, the most common reason for using mouthwash is probably bad breath, but the effect is short-term at best. Mouthwash does not address the causes of bad breath, which include periodontal disease, you know these answers by now, tooth decay, and poor gastrointestinal health. And if you use alcohol-containing mouthwash, that also causes dry mouth, another contributor to bad breath. On the most rarest occasion, if I have to use an antibacterial mouthwash because I've just had a big onion and garlic lunch and I have a big meeting a couple hours later, that won't do much harm. But for the most part, I have to say I don't even use mouthwash because I keep my teeth and mouth healthy. If you use a mouthwash, you want it to be the healthiest one possible. But the best way to prevent bad breath is to brush and floss daily, use a HydroFloss oral irrigator, address cavities and gum diseases properly, and maintain optimal gastrointestinal health, which includes protecting your gut microbiome. And again, I want to bring up the Hallelujah Diet, oral health probiotics. That is what I use to rid bad breath permanently, to build healthy teeth and gums. You want to get the oral health probiotics to support healthy ears, nose, and throat, improve your immune system. So again, if you have a healthy mouth, then you won't even need to use mouthwash. And look at the labels of what you're putting in your mouth. This is one of my favorite topics, oral irrigation. It's my favorite device to use along with my electric toothbrush because it has a pump, a motor, a reservoir, a little jet tip, and you follow along the margin of the gum line and between the teeth, and you irrigate both sides of the teeth. You do it for about 2 months. Sorry, I'm just trying to see if you're listening. You do it for about 2 minutes. That's funny. And especially if you wear braces. So this is the oral irrigator I've used for over 12 years. I use it because it's the very best one on the market. I take it with me when I travel and on the flight. Hallelujah Diet sells it. This would be one of the very best things you could get to help your oral care. Irrigating on a daily basis removes debris between your teeth, stimulates and massages gum tissue, disrupts plaque accumulation, fights infection, and only the HydroFloss has this special magnetic way of making the water flow out. And the clinical studies show that the HydroFloss with the magnetics is 44% more effective than the non-magnetic irrigators at reducing plaque and calculus. In other words, this magnetic water goes onto your teeth and inhibits bacteria's ability to adhere to the surface of the teeth. And if you have inflamed or bleeding gums, periodontal pockets, crowns, bridge work, veneers, implants, orthodontic appliances, the Hydro Floss will be invaluable for your oral hygiene program. And an experiment I did when I first got it is I brushed my teeth with even my good electric toothbrush, and then I did the oral irrigation afterwards, and I was shocked at a few things that still came out that the brush didn't get, but the oral irrigator got. And by the way, there are a couple things I use, and I use warm water because it feels better on my teeth than cold. And I put silver biotics in my water. I actually use a half a teaspoon per session. And most of you watching know about silver biotics. They sell this beautiful liquid at Hallelujah Diet, but it's got a superior patented silver technology that is easier to absorb. It's great for your immune system. It's great if you have any infection in your mouth, and it's better than any other silver product on the market. Now, for 1 or 2 times a week, I put in nascent iodine. And iodine, as you know, it's great for your thyroid and all the glands of your body. Every gland of your body needs good iodine, and most of us are deficient. And 1 to 2 times a week, I will put about 6 drops of the nascent iodine that I get at Hallelujah Diet. And it's that I use that in my oral irrigator. So I would say if there's one thing you want to get immediately is make sure you've got good toothbrush, make sure you have floss, and get this oral irrigator. It will change the health and vitality of your teeth within a couple days of using it. Oil pulling is an old ancient technique I write about in my book. You put about a tablespoon of, I use raw coconut oil. You don't swallow it, you swish it in your mouth, and it cleans your teeth, and it helps to get rid of toxins in your mouth, helps with any throat dryness. It helps to whiten your teeth, reduce inflammation. You can read more about it here or in the book when you revisit. Here are some famous sayings having to do with teeth. You'll be interested in the bottom one, how wisdom teeth got the name when you revisit. Talk to your dentist and hygienist. They're there to answer your questions. Ask any question you can to help you learn how to keep your teeth as healthy as possible. The takeaway today is with proper dental hygiene, you can keep your teeth for their entire lives. Taking good care of your teeth is important if you want to have your whole body running healthfully and efficiently. And I love this Revelations 21:5. Behold, I make all things new. Let's make your oral care a new program for you to start today. And if you're interested in any of my books or my 3 websites, you can see them here on this page. And then if you want a personally autographed copy of my book, you'll see here and at the bottom, sign up for my free monthly newsletter on the home page at SusanSmithJones.com. Here's another one of my books. You can get an autographed copy with a note from me, a note card, and a bookmark. So are you ready for superb oral care? Let's see what you might answer yes to. Yes, you're going to upgrade your oral care and brush at least 2 times a day and floss every night. That would be great. You're going to get an oral irrigator to help with your oral care program. You're going to check with your dentist about whitening your teeth. Maybe you do. Let me just call your attention to the strawberry. Here's a really good way to whiten your teeth. Juice some strawberries, get organic, of course, juice them, and then brush a little bit of the juice, paint it on your teeth, the teeth that you see, leave it on there for 5 minutes, and rinse your mouth with some warm with a pinch of baking soda in it. That will really help whiten your teeth. By the way, baking soda alone, I use baking soda for dozens of things in my healthy lifestyle. That could be a whole webinar by itself. But baking soda alone or with vinegar helps to balance the acid levels of the mouth and helps fight plaque, bad breath, and reduces gum swelling. sometimes I'll take a half a teaspoon of baking soda, I'll put it in a little cup, and I'll mix a little bit of that with my favorite, I get organic toothpaste, and then I dip my brush in and I brush, and it makes my teeth whiter. So let's see if you're going to do some of these things and some more thoughts about smiling brightly. I like that smiling firms your facial muscles. It does. Who needs to go get plastic surgery when all you need to do is smile? They're free. They're worth a lot. They're the shortest distance between two people, and it is the prettiest thing that you'll ever wear. Here are some more reasons to smile. It takes a moment, but the memories of it could last, and you never know what person you're passing in the street might really need to see your smile that day. And a hello, how are you? Because, see, my mom and my grandmother taught me to live by the golden rule, and I think we always want to treat others the way we want to be treated, and that means being kind to other people. So dental hygiene thoughts: 2 minutes in the morning, 2 minutes at night brushing, 4 minutes of brushing throughout the day, but I would add in the flossing and oral irrigation. So we're talking 5 to 10 minutes. And this is so important. The toothbrush does not remove 6 months of tartar 30 minutes before your appointment. Good oral health is good overall health. When people come to see me for consultations, or I see people around the world, I fly all over to meet with people, the first topic I address is their oral care program, just because it's the beginning. It's so important. Here are some other thoughts that you can read when you revisit. Dentists are medical professionals who let you put your money where your mouth is. I like this one. A dental hygienist is sweet enough to make you smile, skilled enough to protect it. Here I am with my horse. God blessed me with a tongue to speak positively, teeth and gums to chew nature's healthy foods, and lips to smile at life's countless blessings. You can see I have pretty healthy teeth right there. And I'm only adding this in because this is the dentist I go to. People often say, well, Susan, I'm coming to Southern California or Los Angeles, and if I have any dental issues, what dentist do you go to? So I'm just putting down the dentists I go to. They're fantastic. And a great smile creates the first best impression. So again, as I said right at the top, and we'll address a couple questions here, God blessed us with a miraculous body and a mouth with teeth, gums, and a tongue. And one of our gifts back to God is to take really good care of our oral hygiene. Make it a top priority. And I hope you revisit this presentation because you can see we just skimmed over a lot of it. I want to keep you inspired and motivated for sound, comprehensive oral care. And start today. You can start today when this is over by brushing your teeth and flossing. I would encourage you to get oral irrigator, the HydroFloss, and I see we've got 2 questions here. When do I use it? You know what I do? I'm busy throughout the day, and I use it at night. After I have my last meal, I use my electric toothbrush, and then I use the oral irrigator, to which I often put that half a teaspoon of the silver biotics. Again, you can get all this at Hallelujah Diet. And then I think I don't need to use it in the morning because I haven't gotten up in the middle of the night to eat, and my teeth are still clean from what I did the night before. So I usually use it at night. If you remember that little picture of it, there were 2 little knobs. The left knob turns it on. It's so easy to use. And the right knob makes the intensity higher or lower, the pulsating jets of massaging water. If you have dental issues now, start with that on a low level. And then every week you can turn it up a little bit. And then you'll find that what maybe felt a little uncomfortable right at the beginning isn't uncomfortable because it will help with the swelling and the inflammation in your mouth. It's like a miracle, simple, not too expensive item, the HydroFloss oral irrigator, that will make a world of difference in your program. And like I said, that sometimes I'll put the nascent iodine in it, 6 drops, 1 to 2 times a week. Most of the time, I do put in the silver biotics, and I just use a half a teaspoon. And again, I use warm water. Someone just said, where do I get it? So I've just said you can go to Hallelujah Diet, and they sell it there, which is great. You have it right there. Someone said, why do I put my barley max? Why do I eat it by the spoonful? Well, here's why. Because remember I talked about earlier, if someone uses a nitroglycerin tablet, it gets right into the body. Well, there are a lot of vessels in the mouth, and I like that if I just let that teaspoon of the delicious barley max, either in the original mint or berry, just rest in my mouth. It kind of melts away. It tastes great. I know it's getting it in my system more quickly. That doesn't mean I don't use it other ways. I put it in my smoothies. I blend it in freshly made juice. I take it by water. But I just love to take it by the teaspoon because I think it's delicious, and I can taste it better. So, and you can obviously, that's made by Hallelujah Diet. That's where you can get that. Someone said, oh, how do I clean my toothbrush? So first of all, I keep it covered. Remember, I don't keep it out on the bathroom counter. And make sure you have a lid on your toilet. I've gone to hotel rooms where they have like new high-tech toilets without a lid. Oh my gosh. So put the lid down before you flush the toilet. Keep your toothbrush covered. You never want to see frayed bristles because that means you're not going to get good cleaning. You want to replace your toothbrush at least every 3 months. I do it every month. And I am very partial to my electric toothbrush. I said I use my manual in the morning, and after my meals, I have a little portable covered one I take in my purse or tote bag when I go out, because if I'm in a restaurant, I like to go brush my teeth afterwards. If I can't, I will take water, and I'll swish it in my mouth. If I can spit it out, great. If I can't, then I'll just swallow it to try to get tea or other residues off my teeth. Again, you don't want the sugar and food particles to stay on your teeth for too long. And then I like to use my electric toothbrush at night because every time I finish, it's like I just had a professional cleaning at the dental office. So my hope is that what I've said will inspire and motivate you to take better care of your teeth, to be a better example for your children, and to know that your teeth deserve first-class care. God didn't give us our teeth and our tongue and our gums to abuse them. God gave this so that we could eat and chew and talk and smile and be radiant and vibrant human beings. And I know you can do it. And remember, make an agreement for 21 days to do all of these great things, the floss, the oral irrigate, the brushing at least twice a day, and after 21 days, it will become a new habit. And you are the president and CEO of your body and your life, and you need to step up to the plate and be that president and take really good care of your body and start with your mouth. I know you can do it. I believe in you. And I hope you'll start today. Thank you so much, and I look forward to our next visit.